Hear PEI video. Today we are going to be talking about strategies that we have learned when meeting different situations. The pandemic has made things difficult for people with hearing loss, especially those who perhaps didn't realize that they had hearing loss until they found people had their faces covered with masks and they weren't able to speech read.
When you've had hearing loss for as many decades as Annie Lee and I have, you've not only learned strategies for coping so that you can hear, but you've learned that controlling your agenda is one of the first things you need to do. Think of it, you go to a movie theater, you pick a spot where you know you can hear. You go to a restaurant, you look for a quiet spot. When you go to your doctor's office, you want to make sure that you get the most out of your visit. The scenario that you are about to see is based on feedback that we have received from both doctors and patients since mask wearing became a reality due to the pandemic.
Hello, Joan.
I can't hear you.
How are you today?
I can't hear you.
Hello, Joan. How are you today?
I can't hear you.
You can't hear me?
No.
Okay. Is this better?
A little better.
So you can hear me now?
Not that well.
Not that well. Maybe it's my accent.
It could be, but I don't hear you that well.
Okay. Thank you.
When someone shouts at me, I just turn down the volume on my hearing aid. Louder is not clear.
What could have made this encounter more positive? First off, the patient should have been upfront before the appointment to let the doctor know that she had hearing loss. She should have worn a hard of hearing pin, and she may wanted to have considered bringing someone into the appointment with her. What could the doctor have done?
As physicians, if we're not directly dealing with a community of people with hearing deficits, it's not something that we typically address adequately.
One of the responsibilities of a doctor is to be aware of hearing loss issues, and perhaps in this case he can't be faulted because he was unaware of what to expect. But it would have helped if the doctor had worn a clear window mask. The doctor could have used a hearing loop in his clinic room, which would have perhaps allowed the patient to access what he was saying through her hearing aid, but through the telecoil function.
An essential tool that every doctor's office should have is a pocket talker.
The pocket talker is a small amplification device which will amplify sound. It's relatively inexpensive and very easy to use.
If you are a patient with mild hearing loss and don't have a hearing aid, this device is useful while having a conversation, including a visit to the doctor's office, and even for watching TV at a lower volume of sound.
And let's face it, there's nothing wrong with good old pencil and paper where he could have written his questions and she could have talked. Because the problem wasn't that the doctor couldn't understand what the patient was saying. The problem was that the patient couldn't understand what the doctor was saying.
Dr. Mackay, why do you think as a physician that clear window masks are important?
The biggest issue is just being able to clearly hear what's being said. There's a muffling that happens with the masks that we currently have, so that's a big issue. But the other one is just being sensitive to how much we all depend, not just those with a hearing impairment, but we all have, to actually seeing the articulation, the person's mouth as they speak. It's not only the the speech itself. It's all the associated facial movements, it's the expressions that people have that help to shape the conversation.
There are many ways to make it a more successful visit.
If you are a medical provider, be observant. Is your patient wearing a hearing aid, a cochlear implant, or a hard of hearing pin? And if you are the patient, do not hide your hearing loss. Be upfront.
Tell the doctor or tell the receptionist that you have a hearing loss, and be sure the doctor is aware of the situation. Face each other. People with hearing loss use speech reading techniques. Get accustomed to an unfamiliar voice with some pleasantries. Talk about the weather, for example. Repeat or rephrase what the doctor says and make sure you have understood correctly. Write down key points and diagnosis. Don't shout. Louder is not clearer. Do your homework before you visit the doctor next time.
We hope that you found this encounter interesting and that it will help you in the future as you go forward, whether you are the doctor or the patient. See you next time.
Bye-bye.